Good morning, and thank you for joining us for today's Central NC Policy Institute. My name is Dawn LeBlanc, and I am the training coordinator for PCANC. Just a few things before we get started. Today's webinar is being recorded. All microphones have been muted and all cameras have been turned off. Today, at the end of our webinar, each participant will be receiving a recording of the webinar as well as any documents that were discussed during this presentation. Please also look out for a survey to come to you via email after the webinar as well. We would love to have your feedback of your experience today. Now I'll turn it over to Stacy to get started on our webinar today. Stacy.
Thank you, Dawn. Welcome, everyone, and thank you for joining us for the 2020 Regional Policy Institute. My name is Stacy Justice, and I am Associate Director of North Carolina Families United. Our planning team and sponsors are excited to bring you today's lineup of speakers and presenters. We're thrilled to welcome Lisa Cawley as our opening keynote, followed by Advocacy 101 presentation by Malia Rose Waters, Policy Director with Prevent Child Abuse North Carolina. We'll take a short break, and then when we return, we'll hear from our parent keynote, Gina Brown from NC Child Welfare Family Advisory Council. We'll wrap up our time together this morning with the legislative panel discussion. We received so many questions from our panelists, and we appreciate the thoughtful questions. So let's get started with a special welcome from Governor Cooper.
Hi everybody, I'm Governor Roy Cooper. Welcome to the 2020 Regional Children, Youth and Families Policy Institute. As we've faced unprecedented challenges this year, I've seen North Carolinians rise to the occasion, working to protect their loved ones from this virus and going the extra mile to help their neighbors. That spirit is what makes me confident that we'll emerge from this pandemic a stronger and more resilient state. As we work to make things better, we need to ask ourselves, how do we help ensure all children grow up in a safe, stable, and nurturing environment? This institute will provide critical information and strategies needed to answer that question and support children and families across our state. As you hear from experts about the issues that impact the well-being of children the most, I hope you use what you learn from each other to help your own communities. Thank you to the people who made this virtual event possible, and to all of you for participating today. Your efforts are making North Carolina a better place for children and families. Thanks so much.
Thank you, Governor Cooper. Now I will turn it over to Deputy Director for Child Welfare Services, Lisa Colley. Lisa?
Good morning. Can you see my screen?
No, ma'am. There we go. I can see you. There we go. Yes, ma'am.
You can see me and my screen. That's
Yes.
wonderful. Okay.
Yes.
Thank you so much for having me here today. It's so interesting to present when you really think about what it means, how nervous you are to do a presentation. Think about when you're actually in the space and you are presenting to someone live. All the things you worry about, like, am I going to trip going up to the podium? Am I going to fall over my words? We have so much more that we have to consider when we're virtual. So just be patient with me as I go through this as your virtual speaker. Just want to thank you for inviting me to do this for this topic. It is a topic that means so much to me. Transforming any type of system that serves children through the use of the perspective of family and youth is so important, because throughout my career started about the same time as one of our wonderful advocacy groups, Say So, and I feel like I've been able to live and see the value of the inclusion of family and youth voice. So I entitled this Transforming the Child Welfare System. I'm transforming the child welfare system, and what I'm going to say is it starts with family and youth voice. Okay. So our agenda, as I talk with you this morning, is I'm going to give you how essential. I'm going to talk to you about how essential it is to include the perspective of those who have lived experience in any work you do to improve a system. And I'm going to use the child welfare system as an example. I'm going to talk with you some about principles to apply to system transformation when you think about the inclusion of youth and families in the work. And then I'm going to give you an example of how this is happening in North Carolina as our practice model is being developed. Okay. So if you think about, we hear a lot about family and youth voice. We hear how important it is. We know how important it is. But if you really look at literature and you start reading, you find a lot about the inclusion of family and youth voice when you're providing services to families. And here are some of the things, the benefits. It increases positive outcome for children. And we all know this. If families, it is the family's life, it is the family's plan. And you can't really do work with families without them being leading and being engaged and having that direction that happens. Because if you think about it, when we provide services, though, there's a structure. We provide services through case plans, and we provide services through child and family teams, through permanency planning reviews, if there are children in foster care. And there's a whole system around engagement of youth and families in service provision. You can read a lot about that, okay? But if you think about it, when you look at system reform, and like North Carolina is really going through a system transformation of our child welfare system, you found less information about how to include the perspective of youth and families in any system change. But when you do, there's a couple of things. There's some things that come up. But there's some really good information from the Administrative Office of Children and Families, our federal partners, that really speak to this. And I want you to think about the level, what the benefits are. And so I've really kind of framed this into three ways that the benefits and how critical it is to include that perspective. And I want you to think about, we hear that word voice, and what does that mean? You should include the voice of children and youth and families in the work as you're considering, your system changes. They can share insights into the strengths and needs of your current system, and I think that's good. But too often, I think we stay there where we hear voice and we hear what they believe needs to happen, but we're not as good as moving forward in what do you do with that. And so you also have to think about the importance to decision making. When you include the perspective of those with lived experience, they offer rare insight that can help prioritize sequencing of strategic changes, and they can also give you logical solutions that can be actioned. I'll never forget, I think when you're a DSS director or you're a child welfare director, there's an expectation that you do some type of fireside chat with your young adults that are in foster care. And when you do that, they give you things that need to change. They tell you what's going well, they tell you what's not. And then when you lay it, and you can just take that and walk away from it and say, oh, these need to change, I'm going to go change that. But if you have an organization like Say So, those organizations train young people to be advocates, and they can actually help you with how can it change, and those logical solutions that you as a service provider may not see, but those who receive services they're at a different place, and they can say, oh, I think this would work. But lastly, what I want you to think about that we don't read a lot about, and as I look at the lifespan of my long career, what the inclusion of youth and family perspective does for me is it ensures that we don't forget the stories, that we don't forget that even though our work and our system changes still exist, and they are hard sometimes because we don't often have all the resources we need. We don't have easy answers, but when you hear the stories and you understand what happens, it keeps you from being complacent, and it makes you work and push through those challenges. And it gives you that commitment to the changes that need to happen. And so I think these three things, so when I started with, it is beyond voice. You can hear, but you have to act. And if you don't keep those stories and that real life perspective before you, you don't know, you can sometimes get complacent with how the system is. And so the perspective of engaging youth voice does that for us. It makes us continue to work in spite of the challenges. Okay. So there are some critical principles if you want to include young family and youth voice in your work. There's some critical principles that you have to remember that make it successful. One, you have to prioritize it through formal processes and structures. You think about when you talk about you're providing services to a family and you're going to engage the family, you're going to have a case plan, that structure, you're going to have a child and family team. Well, when you're including children, young adults, and families in any type of system transformation, you have to have those structures too, because you can't just tee up a group and let them tell you what needs to change. That group wants some answers back, and you have to have a formal structure and that feedback loop to make it happen.
Lisa, for some reason, can you stop sharing your screen and share it again? Because for some reason, the audience can't see your slides.
Oh no. Okay.
I can see your slides, but they cannot. Try it one more time. Okay. I can see them. Yeah, we'll try to keep it. Sorry to interrupt you.
That's okay. Can the audience see them now?
We will check and see.
Okay. I can also go slow.
I am getting some text that some of the audience members can see them, so go ahead.
Wonderful.
Thank you.
Okay. So the critical principles prioritize youth voice through formal structures and processes, ensure opportunities to co-create a vision for how the work will be done. That means you're doing any type, the changes that you're making, you're doing together. Consider the importance of compensation or inclusion in the workforce. So when you look at if you're going to do system transformation and you're going to ask a group of people who have lived experience to really participate, their limitation there's only so much volunteer time that they have, and you have to look at If there is a value, is there stipends, is there compensation, or are these people that we need in our workforce? And so just consider the importance of that. And I'm going over in this manner just because I'm going to talk a little bit about how child welfare includes youth and families in our system transformation, but all programs should include youth and families in how they provide services and have these feedback loops. And these critical principles are important to us all. So the other thing to always remember is to challenge that power dynamic between youth, families, and agencies. You can't forget that, you know, if you come to the table with 20 years of experience in a system, your family partner does not have that information. So it's so important when you talk about those formal processes and structures, it's so important that you make sure that those who are at the table with you, if you're going to share any type of systems changes or reforms, that they are trained, that they understand. You can't use the social work lingo that we just used, and you have to make sure that they come to the table prepared. And you also have to realize sometimes, and I just call this stepping back. Sometimes you have to realize if I have a position of perceived power or authority and I immediately voice my opinion, that may stop others who may really have better ideas than I do from voicing their opinion. So you may sometimes have to step back and allow space in the room for that feedback to be free flowing. And also you really have to change the words you use to describe parents, youth, and caretakers. If you think about it, young people who emancipate from foster care, they are young adults. They are not kids. And if you think about if you talk about families who have children in the child welfare system, especially in foster care, they are parents. They're not bio parents. If you've adopted, you're a parent. You know, you might be a parent who adopted, but you really have to think about the words you use to describe. You know, the words you use here have to be the same words as you use everywhere, and it really keeps you in a place of thinking about what's the best way. How do I frame this? And so those are really critical principles. And when I talk about North Carolina and our child welfare system, these are the things that we thought about as we built a real system that will help us positively impact North Carolina's child welfare system. But these are critical principles for us all. Okay. So now I'm going to move. I've talked in general. I've spent a little time in general talking about the inclusion of youth and families' perspective in system changes. And I'm going to move now to North Carolina. Okay. So what's going on in North Carolina? Well, there's a lot going on in North Carolina. We, like all states, have to implement the Family First Prevention Services Act. And I'm not going to go into all the details, but that means changes to our congregate care where there's a 2-week time limit to young people that can live there. And we get to add evidence-based services to prevent entry into foster care. So before we had the Family First Prevention Services Act, we also had a response to Rollins Law. And that created through work with the Social Services Working Group, which had a lot of stakeholder engagement in, a move to the regional support model, where services will be oversight of Department of Social Services will happen through a regional model. And then it also called us to move to a child welfare practice model. And so when you think about the broad scope of this work, how do we ensure that youth and families are included and engaged? Because these are two big reforms, federal with FFPSA and Rollins Law with state, that would not be successful without the perspective of young adults and families that receive services in North Carolina at the table and fully prepared. Okay, so how are we organizing and making sure that happens? The first thing we did is we organized the work into five buckets, 5 work streams addressing safety, permanency, well-being, continuous quality improvement, and workforce. And these work streams really have all the work that needs that needs to happen over the next 4 years, because we've already finished a year, to really live into what it means to be a robust, strong child welfare system. And this work is what our plan to the federal government is comprised of, and that's called the Child and Family Services Plan. So we have a really good working relationship with DSS directors. We put together a joint leadership team between a strong group of child welfare experts that are the DSS directors and state leadership called the Unified Leadership Team. We have that group. But then beyond that, how do you make sure that you are connected to those who know best, those who receive services? And so we created design teams. And we have design teams for each of these work streams. So there's a safety design team, a permanency design team, and on and on. And on those design teams, there are diverse stakeholders that weigh in on the strategy. They weigh in on North Carolina's plan to meet the commitments in each of these work streams. And so one of the things that we capitalized on to include in our design teams are there are 3 groups in North Carolina that really are comprised of people who have a perspective about child welfare that needs to be heard. And so our design teams, every design team includes someone from SASO, and those are young adults who are advocates. SASO is a youth advocacy group, and they're young adults who advocate for changes in the child welfare system, especially the foster care system. And so we had two members from SASO on each design team. And we also, North Carolina is also has a Child Welfare Family Advisory Council. And you're going to hear from Gina Brown later in this presentation. And both of these groups have spent significant time being educated about child welfare. They understand the dynamics, they understand the lingo. They come to the table fully prepared to meet with professionals who are in the child welfare space. Then we also included in the work streams that were specific to foster care, the Foster Family Alliance. So these groups are represented on those design teams and weigh in as we consider any system transformation. And when you think about those principles of you have to be organized, you have to have infrastructure. These groups are already organized. They have ways of training and making sure that their members show up prepared, and they come to the table already as advocates and have been a big benefit in those design teams. Okay. So that's our strategy when you look at all of child welfare transformation. And so those design teams meet monthly. These folks are at the table. But when it came down to a part of Ryland's Law, what I want to spend a little bit of time talking about now is a part of Ryland's Law was that North Carolina would have a practice model that we would, and the benefits of practice models are many. And so I'm going to spend some time talking about where we are with the practice model. And then I'm going to talk with you a little bit about how we've engaged youth and families in development of that practice model and how that iterative nature will lead us to a place where many have given feedback on our practice model. Okay, so when we think about a little bit of basics on a practice model, what does it look like? What will it look like when we're done? When we actually say we are finished and we have a practice model, there will be a clear vision for how North Carolina will promote safety, permanency, and well-being for children and families. And we will all be able to have that vision. We will all be on the same page with that vision. It won't be served, we won't talk about, well, this county does that, this county does that. We'll talk about North Carolina does this. And this is something that has been needed for a long time. And it will be rooted in North Carolina's values of safety-focused, trauma-informed, family-centered, and culturally competent. And I will say, out of Ryland's Law, of those 4 values, the 3 were there, came from Ryland's Law: trauma-informed, family-centered, culturally competent. The safety focus was added because our model has to be safety-focused to ensure that children are protected. So that's where we're going with the practice model. Okay. So how do you get there from a practice model to practice standards? What does it mean to build a practice model? What is the practice model, as we said, is a framework, a way of organizing principles to guide an agency, and that's the state. And this comes from NERN, which really gives you good information about implementation science. And so the first thing you have to do if you're going to build a practice model is you have to figure out essential functions. That's step 2. What are the essential features that must be present to say the program exists? What do you do? What is the most critical essential functions? And then you have to look at core activities. What are the activities that are observable actions that constitute essential functions? What does it look like? These help to further define and clarify what the function actually does in practice. And then you do practice standards, which is the behavior of workers, leaders, everyone that is involved in service delivery. And so this is how you build a practice model. So it's not an overnight. It's not something you can just, and if in my wish list is that magic wand to go ahead and have a practice model in North Carolina, but that's not going to be sustainable. You have to go through steps to build a practice model, and that process is a way of getting everyone at the table and making sure there's clarity in what you're actually doing. So, what progress and choices have been made? We are implementing safety organized practice, which has a specific tools for workers to use together with families and children. And here are the benefits of safety organized practice. It's a way of identifying harm and danger and having safety networks. You know, a real focus not just on the nuclear family, but who is it that supports that family? Who are the school people? Who is their extended family that can lend a hand both while a family is open for services, but after they are closed as well. And then a part of that is developing behaviorally specific case plans, really teaching us as people that deliver services on how to be real behaviorally specific about, because it's not the resources you bring to a family that make a difference. It's that their behavior changes and they interact with their children differently, and also better ways to engage families in what's important to them. And also safety organized practice relies on evidence-based risk assessment tools. So there is a part of this that is updating the current risk assessment tools that we have, which are evidence-based. It's time to update them, and so that's a part of this as well. And so what progress and choices have been made again? We have, when you go back to that slide with essential functions, now that y'all can see my slides, and we'll flip back and forth. Okay, so if you look here, the second little arrow, essential functions are features that must be present to say the program exists. So we know what we've decided it will be a North Carolina model. We've done the practice model. We know it will be based on the skills and safety organized practice. We've identified our essential functions. And so the practice model will have 5 essential functions, and we have selected those. And these decisions were made jointly between the state, because we are a state supervised, county administered, and that group of county directors that we meet with regularly. And so if you look at the essential functioning, we have communicating in the middle, because it is the core of everything, is that we communicate well. Engaging, that we engage families in services, and we engage others in safety networks, assessing, implementing, and planning. And so those, and they're all, and surrounding that are our values of trauma-informed, safety-focused, family-centered, and culturally competent. Okay, so and each, I'm not going to go through these, but each essential function has a definition. So when we talk about communicating, we're all talking about the same thing. And this is the definition of communicating. Open and honest communication underpins successful performance of all essential functions in child welfare. Then we have engaging, and that it begins with meeting a family and continues throughout child welfare services. Assessing, planning, and this was important to the group because we really wanted an active role. We wanted, when you think about the essential functions of those that provide services in a child welfare space, it's not that you offer, it's that you assist. And so this really looks at how do you plan to assist, and then implementing, that we carry out, that we do. So when you think about, sometimes you think about what do workers do? They don't just give out resources. They should be a part of the plan of linking families to services, making sure that resource is the right resource, making sure that it works. Negotiating between providers and families when things aren't working, a very active role, and that's why the group liked included implementing. Okay, so moving forward together. So now a group of leaders has picked those essential functions, and we're good with that. But moving forward together means you have to seek broad and diverse input into practice standards for each function. So we have to go back, when you go back to here, we have to get our practice standards. We have to understand what are the core activities that are observable actions that constitute essential functions. So to get here, we have to have, how do you see it and what does it look like? To further define and clarify that essential function. And so how do you know someone's really communicating well? What does that look like? And this is, okay. So the design teams are each design team is looking at is a part of developing the practice model. And like I said, we have representation on the design teams from both SASO, from the Child Welfare Family Advisory Council, and the Foster Family Alliance. But we also felt like, and they weigh in on all strategies related to child welfare transformation, achieving our strategic plan. But we felt like for the practice model that we needed to dive in deeper with at least 2 groups to make sure that we had input. And so we developed focus groups to seek broader input. And those 3 focus groups, if you'll look at, we already had the design teams. We also teed up 3 focus groups. 1, youth with lived experience, SASO, and then family with lived experience, the Child Welfare Family Advisory Council. I will say we needed more frontline staff to weigh in on what does it look like, and so we added a focus group there. And so these groups meet. There will be about 4 meetings where they really dive into and think about the power of that. Those with lived experience, asking them, when people that provide child welfare service communicate well, what does that look like? And get their feedback, and how do we document it so they know what to do in our practice model. And this work happens. There is a contract with the Center for Supportive Families that they are working with North Carolina to build our practice model, and so they are facilitating these groups as well as working with leadership both in the counties and from the state in building the practice model and with the design teams. And I will say the design teams, the representation of the design teams have all of the design teams are here. They have diverse representation from private agencies, from stakeholders, from the courts. So if you look at our practice model, will really be built by all the people that represent services in North Carolina. But the focus, when you look at who we dove in and recognized it was critical to engage more, it was families and youth and also frontline staff. Okay, so input from focus group. The first meeting, it's already happened, included an overview of the practice standard development and gathering input on behaviors for one essential function. See, when I talk about the principles of that power dynamic, you have to make sure that as when you bring families and youth and young adults to the table, you have to explain to them, well, how do you build a practice model? Why is what you're doing here today matter? So it started with an overview of understanding a practice model and what they're actually building. And at subsequent meetings, feedback, so they will help define what does it look like when workers do these behaviors. And at subsequent meetings, feedback will be given on the input and how it's going to be used. And that feedback loop happens, which is another part of that structured process. And to reiterate, those with lived experience provide feedback both through focus groups and as members of the design teams. Okay. So what is some of our benchmarks? By the end of July, we had completed all the essential functions. They were complete. And by July 31st, 2021, the core activities and practice standards for at least one essential function will be complete. And by the end of next June, we will have completed practice standards for all essential functions. And that will include determining which of the skills in safety organized practice we will use and train and teach. And so that's a little bit of information about how North Carolina is, how we are developing our practice model. And just thinking about those principles, we have youth, we have families and youth at the table. And because we didn't think we needed additional input, we didn't just decide they needed to be a part of that diverse group of design team. We also decided they needed to be in focus groups to fully hear. Okay. So to kind of wrap up and close, I want to talk about a DSS value. Those of us that work for Secretary Cohen, we have values. And recently, given the concerns that are happening around equity and inclusion, we added another value, and that value is belonging. And I'm going to read this, and I'm going to ask you to think through it beyond the workplace. And the value of belonging for DHHS is to intentionally provide an inclusive, equitable workplace that reflects the communities we serve, where everyone feels a sense of belonging and our diverse backgrounds and experiences are valued as strengths. And I think about this, I put this up here not because you all work for DHHS, because you don't, but I put this up here because I want you to ponder on that. And as I close, I want you to think about what belonging means in this space. Okay. So when you think about including the perspective of youth and families, there's 4 things I want you to think about. I want you to think about it's their voice. It's that they can tell you the strengths and the needs of the system, but you can't stop there. You have to have a way, you have to have structure so they are engaged in decision making, so they are invested, they know they are valued. And then they have to be a part of decision making, and you have to be able to make it worth their time to be a part of those decisions. They have to see the means to the end, and why am I using my time to be here, and what will it impact? I'll never forget engaging with a group of young adults when I worked in the county, and what they said was, we want to change it. We want to change it, and these things need to change. And we had that real conversation about how long it takes to change some things. And they came to some conclusions of, well, we might not be able to change it fast enough for us, but we want to change it for the next group of young people that experiences this. And so that became their frame. And they understood that they were paying, and they would call it paying it forward. And they understood the value of being there. So they have to be engaged in your decision making. But the last thing I want you to think about as you think about, and which I will certainly, with our DHHS staff, will certainly think about as we live into inclusion of youth and family voice in our work, think about living into that value of belonging. So go back. So if you believe, I'm going to go back. So if you really believe that the work of system reform is shared, then the workplace is what we're doing in those teaming structures like our design teams. And they should reflect the communities we serve, and everyone should feel a sense of belonging, and that our diverse backgrounds and experiences are valued as strengths. I don't know what it's like I might be a biological child of a foster parent, but I don't know what it's like to be in foster care. Other folks may not know what it's like to place young people in foster care. And so together, we come together and we have those diverse experiences. And if we think of them as strengths, we have a way, and we live into the value of belonging and understand that when we join with young adults and families and ask them to work with us, we have to make sure that they have that sense of belongings to those groups and that their perspectives are valued. So I just want you to think about these 4 things. Beyond voice, have to be engaged, they have to be able to be a part of decision making and understand that their decisions matter. And they also have to have that sense of belonging to where they understand, you know, I don't just show up, I'm not heard, but my voice is acted on. And that real sense of belonging is what will push us to make real changes in the child welfare system, as well as any other system that has a need to improve.
Thank you. Thank you so much, Deputy Director. We appreciate it. We've had a lot of positive comments in the comment section and some questions, and we'll make sure that you get those questions so in case they can be answered. And we appreciate your time today.
Thank you so much, and thank you so much for inviting me. I think you're next. There's a lot of highlights in the Institute, but I will say you also have Gina Brown, and she will certainly some of the information that I presented.
Awesome. Thank you so much. We appreciate it.
You're welcome.
All right. I'm going to now turn it over to Malia Rose Waters, Policy Director with Prevent Child Abuse NC, to provide us with our Advocacy 101 presentation. Go ahead, Malia.
Hi, everyone. Welcome. I'm going to screen share, and I apologize. I know some of you were not able to see Lisa's slides, and I apologize for that. Hopefully, you're going to be able to see my slides. Stacy, can you verify that you can see my screen?
I can see your screen.
All right. I'm hopeful that you all can see me and also see my slides. I will be sharing these, so if you're not able to see them, I apologize. You'll have an opportunity to look at them later. But Advocacy 101, where to begin, that's what I'm going to be talking about today. For each of the 4 institutes, we're going to have 4 different Advocacy 101 presentations. So there are some common themes throughout all 4 of them, but they're all 4 different from different presenters. We've had NC Child, we're going to have Moms Rising, and we're going to have Eye to Eye also. And I say that because if you're interested in Advocacy 101 and how to get started, I think we all have a little bit of a different perspective in how to get started. So I encourage you to ask for the recordings if you're not able to attend the other ones. So topics to be discussed today. So I'm going to go over our policy priorities at Prevent Child Abuse North Carolina just quickly. We're going to cover what is advocacy versus what is lobbying, effective issues, advocates, and advocacy. So how to be effective in this work, advocacy strategies and tactics, how to engage policymakers, partnerships, developing your message, the value of story sharing, and taking action. So at Prevent Child Abuse North Carolina, we have 6 main policy priorities that we focus on. I encourage you, if you'd like to read more about them or sign up for our newsletter and our policy alerts, you can go to our website at preventchildabusenc.org. But I just wanted to give you an idea of the policy priorities that we focus on. They include expanding evidence-based home visiting and parenting education, family-friendly workplace policies, that would be things like paid family leave, family economic supports, quality, affordable childcare, something that's on so many parents' mind right now as so many childcare centers across the state are closing, the prevention of child sexual abuse, and the implementation of the Family First Prevention Services Act. So we believe that prevention happens in partnership, but also advocacy happens in partnership. And I have quite a few things on your screen here. One is the protective factors framework. That's the protective factors that prevent child abuse and neglect. We also, when we're thinking about our policy priorities, we look to the CDC. They have several technical packages on preventing ACEs and preventing child abuse and neglect. That also informs our policy priorities. The Essentials for Childhood framework out of the CDC also does. We also work with our partners at Think Babies. We took a look at the Early Childhood Action Plan and aligned some of our policies there. And we're also part of the Home Visiting and Parenting Education System Planning work. And these are just a few examples of how partnership is so critical and so important in the advocacy space for us and for everyone. So a few things that I want you to remember as we get into the content of the presentation. In a representative democracy, you're the boss. So trusting relationships are the keys to the kingdom. Networking isn't a bad word. I know that's hard to do right now when we're all mostly working from home, so many of us, but it isn't a bad word. Getting to know people, making connections. Take advantage of your state and national networks. Start with modest goals and expand over time. Try to find an advocacy mentor. Try to find someone that you can talk to through this work. Expect to make mistakes and to learn from them. Be creative and be bold, and give partners a heads up whenever possible. So first, we're going to start with defining advocacy. What is advocacy? It's to defend or promote a cause. It's active, not passive. So it's just one of the many ways to approach a problem. I have in here partnership, because partnership, I feel like, is so important as far as advocacy goes. Advocacy can be part of a community initiative, more partnership within the community. It's not a direct service, and it does not necessarily involve confrontation or conflict. So I wanted you to see here the potential levers for change. There's an advocacy toolbox, a lot of different ways that you can go about this work. We're going to focus today on the yellow highlighted, the policy, advocacy, and lobbying. One of the questions that comes up pretty often is, what is the difference between advocacy and lobbying? So advocacy is the public support for or recommendation of a particular cause or policy. So key advocacy activities: educating and informing lawmakers, helping to shape the state laws and budgets, making your voices heard about important issues that affect our daily lives, helping policymakers find solutions to problems, providing critical information for adoption or rejection of introduced legislation, urging the public to contact policymakers to advocate for the adoption or the rejection of legislation, telling your member of Congress how a federal grant you organization received has helped your constituents, educating a member of Congress about the effects of a policy on your constituency, inviting a member of Congress to visit your organization so that he or she may see firsthand how funding or a policy affects day-to-day operations and the difference it makes. That's the last bullet point. It's all bolded. I think that's so critical. Inviting your local policymakers to your organization so they can see the people that you're serving. Advocacy versus lobbying. Now we're going to focus on lobbying. See, when you're lobbying, you're seeking to influence a politician or public official on an issue. So the activities involve direct support or opposition to a specific piece of proposed legislation. The IRS does have strict rules regarding the percentage of a nonprofit's budget that can go toward lobbying activities, and we're going to talk a little bit more about that. So it's also about asking your member of Congress to vote for or against or amend introduced legislation. It's when you're emailing a call to action to your members, urging them to contact their members of Congress in support of an action or introduce legislation, or preparing materials or organizing events in support of lobbying activities. So I got this information from the North Carolina Center for Nonprofits. They are an excellent resource for you if you have any questions about advocacy versus lobbying within the nonprofit space. So I'm worried that as an employee of a nonprofit, I'm not allowed to advocate or lobby. Can I? So it's legal for 501c3 nonprofits. Your nonprofit will never get close to the legal limits for nonprofit lobbying, and you probably don't need to register as a lobbyist. Great, so you can advocate. How much? Infinite. You can advocate and educate as much as you want to as someone who works at a nonprofit organization. It's where lobbying is where there are more definitions and rules around that and how much time you can spend. Again, I encourage you to reach out to the folks at the North Carolina Center for Nonprofits if you do have any questions about those limits. So we're going to talk a little bit about efficacy, the ability to produce a desired or intended result. So effective issues. When you're thinking about your issues that you want to talk to policymakers about, they're easy to understand. You have a clear target. You're non-divisive. It results in meaningful life improvements, instills a sense of power to the powerless, are broadly and deeply felt, and they're winnable. So who makes the most effective advocate? Those who share a personal connection with the issue, those who could be impacted by the issue, and anyone who wants to make a difference makes an effective advocate. So when we're thinking about effective advocacy, though, the rightness of the cause, when we're thinking about justice, just cause, the power of the advocates, more of them is much better than less. Again, going back to partnership, working together. The thoroughness with which the advocates research the issues, the opposition, the climate of opinion about the issue in the community, their skill in using the tools available, including the media, and above all, the selection of effective strategies and tactics. So we're going to talk for a little bit about picking your effective strategy and tactics. One, call your legislator. That's one way you can advocate. Send personalized emails and letters. You can send form emails or to take action. You can send it out to your membership or your constituents and ask them to take action. You can invite legislators to visit your organization. Again, such an important piece of this work. You can sign a petition. You can tweet at your legislator. You can schedule a virtual meeting, or you can schedule meetings in district or at the General Assembly. And there are tons of other strategies and tactics, but I think these are probably some of the most popular or well-known ones. We are going to focus on scheduling in-person meetings in district or at the General Assembly for today's presentation. So what do you need to do? Lay out your goals. Join or build a coalition. Develop a plan and take action. So these are the steps. If you're going to start advocating, get some goals, have a good idea of what you'd like to see happen, join or build a coalition, working in partnership, develop a plan for what you would like to do, what's your strategy, and then take action. Engaging policymakers. So get to know your legislators and your policymakers. Relationships matter. It's so important within this work. Build a solid relationship with your legislator or policymaker that is based on mutual respect and trust is crucial. Grassroots matter. Advocacy starts at home. What's happening in your community is most important to your legislator. They want to know what's happening. What are you seeing? What are families and children and youth experiencing in your community? The simplicity of effective grassroots work, educating the legislator or the policymaker, creating trust and offering assistance, and taking enough time without taking too much time. So here at the North Carolina General Assembly, just wanted to share this general information with you that we have 120 members in the House. We have 50 members in the Senate. Terms for the House and Senate members last 2 years, and the elections are in even number years, which we are in an even numbered year. ncleg.net, great resource for you to go and learn about who represents you in the House and in the Senate right here in North Carolina. Identify your targets. So I encourage you that after you find out who the representatives are for you, that you decide who do you want to talk to, identifying your targets. Decide I want to talk to this person or that person. And it doesn't necessarily have to be someone that represents your community. However, legislators do want to hear from their constituents. Gathering your partners. So advocacy happens in partnership. And part of the reason why I continue to say that is that these institutes, for example, would not be happening today if there wasn't partnership happening through the collaborative and See Child, Eye to Eye, all of our sponsors. This would not be happening and the work would not be happening without partnership. Collective advocacy happens when a group of people with similar experiences or challenges support each other about an issue that affects them all. The group has a unified voice that is often difficult to ignore. So I encourage you to find out what organizations or coalitions are also focused on the same issues that you're interested in advocating for, and then join their efforts. You don't have to reinvent the wheel here. There are many advocacy organizations that are working on a lot of different issues. So I would reach out to them and find out where they are. Where can you plug into their work? Messaging. One of the most important parts of this, what are you going to say? So crafting your message, you determine what your ask is and you keep it consistent, clear, and concise. Gather your compelling facts and the supporting data for that. So the ask, change in funding or spending, access to services, change in service or system, specific vote on an upcoming bill. Like that's what your ask is. I would like for you to, whatever you would like for them to do. Why? So you want to tell them, why will it improve the lives of children and families? How will it economically make sense? What's the current status and what are your expected outcomes? So this little guy here, the owl, I thought was funny. He's kind of looking sideways, trying to figure out the messaging. Messaging needs to be easy to understand, plain English, no jargon, okay? Needs to be accurate and factual with reliable primary sources. It's always good to cite your sources within your messaging. You need to be consistent among all the messengers. So if you're working as part of a coalition or in partnership, then sit down together and decide what is your consistent message. It should be tailored to the interests of your intended target. So what you would hand to your legislator is going to maybe look different than what you would hand to your county commissioners, for example. Your messaging might be a little bit different depending on your audience, and it's important to tailor it every time you're going to have a different audience. It needs to be concise and to the point. Make it easy to remember and repeat. And then I highlighted here at the bottom of the page, don't forget to develop those leave behind materials so they'll have something. So you want to be concise, easy to read, easy to understand, and something to leave behind as well. Developing your message. So after you do all of your work and you develop your message, you don't want to put it just in a bottle and it go to nowhere, right? So whether you're trying to communicate with an elected official, the media, or trying to get your friends or neighbors engaged, it helps to think about your message. So you can kind of break down a message into 4 different parts: the value message, the problem message, the solution message, and the action message. So the value is starting with our shared values, and it helps audiences to hear our messages when we're talking about shared values. You can talk about your problem message. So lay out the scope of the problem. Talk about what families and children are experiencing with data and with stories. Solution message. So how can it be addressed? What are you asking for? And then the call to action. You need to have a specific call to action at the end of your messaging. This is what we would like to see happen. So I'd like for you all just to think about what are some of the issues that may be impacting parents in your community. I know for my family and for so many families, I know I have a young child, so we're doing virtual schooling. That is an issue that's impacting many, many parents across the community. And I say that because I wanted to share with you that specific example since it's very widespread across the state right now. And I wanted to break down for you some messaging around parenting education and specifically about Triple P, which is Positive Parenting Program. It's a parenting education program that's available across the state. So if you look here at breaking down messaging around parenting education. So a value message is all children deserve to grow up in a safe and stable and nurturing home. I think that's something we can all agree on. We want all children to grow up in a safe and stable and nurturing home. The problem message. So parents are struggling with the social isolation caused by the pandemic. They're trying to balance virtual school, work, family, life. And then here's also where it would be good to share a brief story of something that's happened, something that you've heard or someone would like to also share their story personally with a policymaker. That's a good time to share that. This is what I'm experiencing right now. This is what my family is experiencing. The solution message. So we're talking about parenting education, right? Triple P gives parents simple and practical strategies to help them build strong, healthy relationships, confidently manage their children's behavior, and prevent problems from developing. So a lot of what I'm hearing is parents feel overwhelmed, right? And they're having to navigate challenging behaviors and situations. So Triple P could be something that could help them with building the skills and the knowledge and the tools that they need to better manage that while they're doing the virtual education at home. So the action message, educate decision makers about the need for and benefits of Triple P, and ask for more investment so programs can continue to provide services in your community. So defining your needs is part of that. What do you need? Do you need technology to assist more parents with virtual parenting education? Do you need more Triple P trained facilitators so you can reach more parents? What is the specific need that you have? The value of story sharing. Child and family involvement in advocacy efforts can have a huge impact. There's so many issues that are happening right now, like funding for programs, Medicaid transformation, early childhood interventions. So you can become a resource for very difficult decisions as part of that. And I say this because sharing your story helps inspire action through emotion and connection. In our last institute, the legislators actually lifted up that they want to hear the stories, that's so important, hearing the personal stories of what's happening. Compelling stories that can move others toward change are about real life experiences, not abstract theories. They invoke feelings of urgency, of hope, of anger, of solidarity, of self-efficacy, and can inspire action and overcome emotions that inhibit action. So now we're ready to take action. You've identified your target, you've developed your messaging, you have your lead behind materials ready, you have partners who want to advocate on the same issue, so it's time to schedule a meeting. Asking for the meeting, don't just show up. A little bit different right now as we're still doing a lot of social distancing, not happening as often, but don't just show up, make an appointment and tell them why you need to see them. Virtual meetings are also a reasonable request, especially right now. You can have your own Zoom account for meetings for up to 30 minutes for free. Present yourself and your views in a respectful and dignified manner. 15 minutes is the average time you may have with a legislator. 30 minutes to an hour is possible. Use it wisely. That's why we talked about being concise and clear in your messaging. Take written materials and leave a card. So develop those written materials that you're going to walk through with the legislator and leave them with them. Think before you react. If he or she says something that offends you, keep a cool head and respond rationally with facts. In some offices, you all may achieve the first time out as a civil exchange of conflicting opinions, but if you handle yourself well, you can begin to establish a working relationship. And always say thank you. Always say thank you for your time and follow up with an email that summarizes the meeting. So advocacy work is a marathon, not a race. When you become frustrated or discouraged, always ask yourself, if not you, then who? And if not now, then when? You are the change you want to see. So this work can, when you're advocating for something, change takes time to happen. It doesn't happen overnight. And this work truly is a marathon, not a race. Sometimes it can feel like a race, but you still have the long goal in sight. That's also why it's important to have partners, so you can share in this work together and keep your eyes on what you want to see happen. There are tons of resources available. I just listed a few websites here of some of the partners that I know of that do advocacy work. There are plenty more. North Carolina Center for Nonprofits, the Collaborative, there's a research and policy work group that's part of the Collaborative, Eye to Eye, NC Child. During the legislative sessions, NC Child does a legislative update every Friday. So when they come back in session in January, NC Child will start those updates every week live on Friday mornings. NASW, Think Babies, which is a coalition, a group of different organizations from across the state that have a shared policy agenda focused on 0 to 3. Autism Society, Moms Rising, who you're going to hear from next month on one of the institutes, NAMI, and there are many, many more organizations, coalitions, partners, parents, and advocates. If you're not sure where to get started, please feel free to reach out to me or any of the other sponsors of these institutes. They would be happy to point you in the right direction if you need some support in that way. So here is my contact information. If you do want to reach out to me for anything, please feel free. I'm here to support you. We do have a prevention action network that you can join. You can go to our website to learn more about that. We do try to support our prevention action networks around their policy goals as well. So if that is something you're interested in, we do have a pretty active Facebook and Twitter as well, and Instagram. We share a lot of policy related messages on Twitter in particular, but also on Facebook. So I encourage you to check those out. And if you have any additional questions after this information today, I know I kind of went quickly through it. I wanted to make sure that I was able to get through everything. Just reach out to me. I'm happy to email and connect.
Emily, one of the comments in the comment box was, will this presentation be available when the PowerPoint, when the recording is released?
Yes, I will. And what we'll do is when we send the follow-up email, so we're going to send you all a follow-up email that has the survey in it. Please take the survey. We'll also send you my slides and then Lisa's slides if she's fine with that, Gina's slides if she has some and wants to share those. Any of our presenters will send those as well. And we're also going to send you all a follow-up that includes the questions that we're asking legislators today. So you'll have that as well.
All right,
so thank you.
Yeah.
So what we're going to do now, right, is we're going to take a little bit of a break.
Yes, we are going to take a 5-minute break, so we'll come back at 10:15, a little over a 5-minute break, and we'll be coming back with our parents keynote, Gina Brown.
Yes, excellent. Thank you all so much.
All right, everyone. We are going to start back. We are going to start with our parent keynote speaker, Gina Brown from the NC Child Welfare Family Advisory Council. Gina, can you hear me?
Can you hear me?
I can hear you. Can you press on? Do you have webcam abilities?
No.
Okay. All right, that's fine. Do you have the sharing screen option to share your presentation?
I do now, so let's see what happens.
Okay. Awesome. I can see it.
Great. Okay.
Welcome. I will turn it over to you now.
Thank you so much. Hello, everyone. I'm so excited to be here. First, I want to take just a minute to say thank you to all the different entities that sponsored this Virtual Policy Institute today. The Collaborative, NC Child, Prevent Child Abuse, the Eye to Eye Center, Moms Rising, Foster Family Alliance. Any opportunity to get in front of people and talk about the parent voice is wonderful, and thank you. I'd like to also thank Lisa Colley for her words this morning. I know that there are peer partners, family partners from all different types of services here today. And for us to see child welfare state leadership so involved and supportive about family voice, it's just wonderful. So let's talk about this work in North Carolina child welfare. So our council structure, I'm excited to share this information about the council that Lisa spoke about earlier. The structure of the council is 12 members, and it's a good balance of biological, foster, and adoptive parents, kinship caregivers, that's me, and we also have young adults that have lived experience with the child welfare system, and we're all at the same table with no voice being any more important than another one, and we're collaborative in our process. Part of our structure design for family partners to be sponsored either by a county or through the SASO organization for young adults that Lisa spoke about. And the reason for this sponsorship is important. It's because it helps to connect the work of family engagement at the county level, at the case level. And the sponsorship includes a formal application and a sponsorship agreement. And this agreement is to acknowledge that the family partner does have some experience while providing leadership, either through trainings, committees, or mentoring programs, etc. And that the county is vouching for the family partner, saying that they're ready to represent the family perspective at the state level, and that they're going to be able to commit to the level of involvement that is required at the state leadership level. So what is asked of the family partners? What does the commitment include? What does it look like? So we participate in a monthly 1-hour lunch and learn. It's a virtual session. And we have a monthly all-day meeting, which back in pre-COVID old normal, it was called a in-person meeting, and you'd sit at a table and talk to each other, you know, like face to face. But in this new normal, these meetings are also done virtually, and either in person or virtual. Members of DSS bring to us their plans, different programs, and policy items for discussion and our collective input as a council. Another part of the family partner commitment to the council is to serve on at least one of the state's various committees. The council provides family voice representation on advisory boards, such as community child protection teams, Fostering Health and C, Fostering Perspective, the Kinship Guardianship Work Group, the design teams that Lisa spoke about. Some family partners do have the capacity to serve on more than one committee, and it's just depending on their time availability. So let's talk about the importance of family partner training. Okay, this is how we make it all work. This is why we are successful in what we do: structural support and training. So directly from the start, from the application process to policy review, subcommittees and committees, and one-off events like me speaking here today, family partners are always supported. They receive professional development and proper training, and no one is tossed into anything that they don't feel prepared for. Support and ongoing trainings can be found as agenda items for many of our meetings. We receive basic core trainings. For example, training in child and family team meetings, strengthening families, prevention services, and strategic sharing. We also will have specific subject matter training, like federal requirements for Child and Family Services Reviews, Child and Family Services Plan, which is CFSR and CFSP respectively, and also the yearly APSR, or the Annual Progress and Services Report. Now, members of the Child Welfare Family Advisory Council have been included in the last couple of meetings with DSS and their federal partners. And so it's really nice to have the necessary policy background information when you're included in those type of meetings. Now, the membership of the council also has preparation and debriefing sessions, which can be one-on-one meetings, group prep, document review, or small group sessions. And these meetings are also a supportive piece to one of the most important partner commitments for council participation. And that is, we need to do the homework. We need to show up prepared for the meetings that we are asked to join and for the tasks that we're asked to do. The commitment from DSS, who contracts with NC State University Center for Family and Community Engagement to support the program management, family partner support, and that includes funding for their time and travel. Of course, there isn't any travel during this time of the new normal. For my last slide, I would like to share some general guidelines that agencies can use if starting a group for family engagement, or as a reminder when working for families. Number one, you must meet families where they are. Families have no way of knowing how they can be involved unless they're invited. Number two, be prepared to hear some negativity, but also recognize that the families that come to the table can also help come up with solutions. They just need to have the support, information, and training to be part of those solutions. Number 3 and 4, they can go together. Be open and flexible to family challenges, value their perspectives and their time. You will find that family partners, just like you, are dealing with family stuff. Sick kids, virtual schooling, and life just happens to all of us. But the family partners at the table, because they believe they can help, they believe that they can do good work, and that they can make the system better. But most likely, they also have their own job to do. The fifth and last thing, I think agencies should know how important it is to take the time to develop relationships. When agency and family partners have regular connections and can grow respectful, authentic working relationships, we can have meaningful change. Now, here's an example of what meaningful change can look like. We had a suggestion by our council that was accepted by DSS and is now spread far and wide. The federal partners know about it, other states know about it. So all agencies have forms and records and files, and these forms can serve as a dual purpose. Agencies can keep them for their records, but they can also provide a copy to a family with instructions and information. So in child welfare, printed information is given to a birth parent when their child is being removed from their home due to safety concerns. And this printed information talks about what needs to be done to correct that safety concern or that issue. And then there's a section about having visitation with their child while they're working on correcting that safety concern. And parents do not think about seeing their own child as a type of visitation. You know, the word visitation just sends out the wrong message. It's like the opposite of what we call family-friendly language. So we suggested the replacement of the term visitation with the term family time. Yeah, family time, visitation. I know they're both just words, and they both have 10 letters. But to a family, especially a family in crisis, the changing of those 10 letters, you know, can brighten their perspective. You know, for them, it can change their world. So in conclusion, I don't think that we can produce meaningful changes. I think with our collective energies spent on authentic relationships between agencies and family partners, I think that we can move mountains. I'm going to turn control back over to our sponsors, and I wish to thank you very much for your time.
Thank you so much, Gina. We appreciate that wonderful information. Now we are going to move into our legislative panel, and I am going to turn that over to Ann from Eye to Eye.
Good morning, everyone. I'm Ann Rodriguez. I'm the Assistant Director for Eye to Eye Center for Integrative Health. I hope everybody's doing well in these crazy, crazy times. I'm hoping that our legislators will join us. If they would like to put their share screen on, that would be great. And we'll get the panel discussion started. We saw Representative Horn earlier. Good morning, Representative Horn. How are you?
I'm doing quite well. Thank you very much for the opportunity to join you today.
Well, we appreciate you being here. Senator Kravick, I'm hoping could join us. Stacey, do you know if she's going to be able to join us, or Senator Woodard?
She is joining. She will just be on shortly, I think, because we're a little ahead of schedule.
Okay.
She's on, and she's on now, and you should be able to see her. Hey, it's Malia. You should be able to see her as well. You can turn her camera on.
Can you hear me? Can you see me?
Yes.
We can hear you.
But you can't see me.
We can't see you.
Can you see me now?
No, ma'am.
If you go over to webcams, yes.
Now.
Yay!
Good morning.
Good morning. And I don't know if Senator Woodard is going to join us.
We have a last minute late addition, and Senator Woodward should be on.
I'm looking. I don't see him on yet.
Okay.
We'll move forward until he does get on, Ann.
Yeah, okay. All right, well, let's get started. We're really pleased to welcome our legislative panelists. Senator Kravick is the chair of the Senate Appropriations Subcommittee on Health and Human Services, and she's also the chair of the Senate Healthcare Committee. She's a member of important committees like Appropriations, Education, and Finance. And Senator Kravik most recently wrapped up work as the co-chair of the Child Wellbeing Transformation Council, where multiple recommendations were developed to better coordinate children's services. For Representative Horn, education is a focus. He serves as a chair of the House Appropriations Committee on Education, a chair of the House Education Committee, and a member of the House Select Committee on School Safety. He's also a member of some key committees addressing critical issues such as COVID-19 and community relations with law enforcement and the justice system. So thank you both for being here today, and we'll see if we have Senator Woodard join us later. But we wanted to ask you a series of questions and give you both an opportunity to answer if you'd like to. And then we want to save 5 minutes for each of you at the end, where we're wrapping up at about 11:25, 11:30, for you to just say whatever you would like to say. So if you don't mind, we'll go ahead and get started with some questions. And I want to get them right, so I'm going to put my peepers on. The first one is about schools. School-based mental health services can provide convenient access to mental health services that some students may not otherwise have. However, they're also inaccessible to students who are not attending school due to school refusal, transportation barriers, physical illness, mental health issues, or other issues. What solutions are being explored in order to ensure that all students who need school-based mental health services are able to access them, including those students who are struggling to attend school? So would one of you like to start with that?
I'd be happy to start. Thank you very much. This is an issue that's critically important to all of us in education. We know that kids must be both physically, well, not both, physically, emotionally, academically, mentally ready to learn. That includes everything, of course, from school nutrition to what we're talking about here, which is mental health. You ask what things are being explored or pursued by the General Assembly. One of the things we came up with is really based on a pilot program in Union County. I'm not aware of it anywhere else in the state just yet, but we have passed legislation and put some money behind a consortium bringing together our local departments of health and human services with our school systems, getting them to work in a more coordinated manner. Everybody has their plate full. One of the challenges we have as legislators in the funding area is this thing called recurring expense. We all know that we're facing a severe budget shortfall in the coming year. We also know that we've got a fair amount of money that came down from the federal government, but it's one-time money. Well, one of the things you do not do with one-time money is hire people, because that's sort of a shell game. Now you got it, now you don't. So by pursuing this collaborative, I shouldn't have called it a consortium, but a collaborative, that's I think the better word, by pursuing a collaborative between the local school systems and the local Department of Health and Human Services, we can leverage the best talents of both in order to ensure that we get the kinds of mental health services to kids that are most in need, whether those kids are actually in school or for one reason or another not able to be in school or access remote education because of connectivity, etc. Another thing we're doing, of course, we're all talking about connectivity. Everybody's talking about connectivity. We're throwing money at connectivity, but even with that, there's not enough money, and it's not going to happen overnight. Even if we had $10 billion to throw at connectivity, it's still not going to happen overnight. It takes time to run lines. It takes time to do hookups. Then in addition to that, you've got the devices issue, and then the shared devices issue, because many families have multiple children, not all in the same grade. They may have a computer in the house, but mom or dad is using that computer to earn a living and bring money into the house so they can stay in their house. So those are additional challenges. And then the last part is, I don't know about last, but another part, of course, is a subscription piece. Not every family holds connectivity to the same high regard as they hold their television or their telephone. Now, they're more than happy to pay their cable bill so they get TV. They'll pay their telephone bill so they get a telephone, but they might not be so willing to pay their connectivity bill so that their kids can get online for education. Now, that makes no sense to me, but it's a matter of can they, will they? And well, when the can is, can they physically connect, and can they afford the connectivity, and then will they? These are things that we all have to work together in order to accomplish it. So those are the things that we're working on presently. That, as I said, the collaborative connectivity, making devices available. We've had a bill for some time directing that surplus state computers, laptops, be provided to needy kids. Now, we've had some challenges in getting that implemented. There are those folks that have been hesitant, I should say, to pursue this for various reasons, but the legislature has been firmly committed to doing this. We've had work done by the Program Evaluation Division. We've had work done by our education group and the Department of Administration. We just need to make sure they're getting going. So that's, from the House standpoint, that's a wrap up of what we've been doing.
Wonderful, thank you. Senator Kravick?
Thank you. And Representative Horn covered it very well. These are absolutely challenging times. And we've heard from so many parents who the issues that Representative Horn discussed, they are having to stay home with their children, particularly the special needs children are absolutely, their needs are not being met. And when we were back a few weeks ago and we were allocating funding for the COVID relief package funding, we did allocate funds to help those children with special needs because some of them just cannot use remote learning. It's just not working for children with autism. I've spoken with so many parents who are saying that their children are just regressing right before their eyes. So these are absolutely challenging times. In the mental health aspect, we all know that most of those cases of emotional or mental health needs are identified in the classrooms by the teacher. The same with abuse. And we just don't have that currently. We don't have those teachers able to watch those children, to be able to make those reports. And we have done, we've passed a number of bills that for one reason or another didn't always make it through, but we have dealt with a lot of the mental health to try to train the teachers and those on the front line who are dealing with the children, train them in being able to spot those children who have additional needs. But these are difficult times, and we have a lot of work to do to make sure that children are getting what they need.
Great, thank you. Stacey?
If I could, I'd like to add one more thing that we have done, and that is in the last session we passed a bill requiring that we train our teachers to spot some of these challenges, suicides, physical well-being issues, sexual abuse, trafficking, teen dating violence, all of these things that continue to contribute to or are important factors in child well-being. So we're waiting for the state board to come back and tell us what else they're going to need in order to ensure that this training is effectuated. We worked a long time to get this bill right and have it comprehensive, but we think it is a critical piece in being able to first identify and then respond to the needs of our students.
Yes, and thank you so much for passing that legislation. We've been tracking on it, watching it, and are looking forward to the work that will be done both at the state level and at the local level on that. So thank you. Stacey?
All right. Our next question is There is so much talk about value-based care and outcomes leading to more successful treatment. How do you think the prepaid health plans should work with members so that the prepaid health plans know and incorporate in a treatment plan what is important to that youth and family? Either of you, if either of you want to answer, go first.
I'll go first. Medicaid transformation, that's the whole goal, to make sure that we have whole person care, that you have one provider that you can go to that will know all about your health history, that will be able to take care of you. And rather than having fee for service, it will be a per member payment. And the whole idea and the whole goal is to deliver better care for those patients and better access. So the PHPs will be responsible for the health of that individual. So we believe that they will be able to consolidate all of the care for that patient and be able to make certain that that patient is going to all of the doctors, to all of the providers, for all of the appointments, to have follow-up with them. I'm going to tell you a short story. A group of doctors from Greensboro came to call on me, and they were telling me a story about a patient that they had who had been to the emergency department 63 times, I think it was, in a year. And so finally, one of the docs just decided to get one of the community-based organizations to find out what the problem was. Well, they visited her and they found out that she was diabetic. She had no refrigeration. She had no refrigerator to keep her insulin. And so she kept going to the emergency room. Well, those doctors took up a collection, bought her a refrigerator, had one of the community-based organizations follow up with her on a regular basis to make sure she didn't need anything, made sure she had healthy food. And that lady visited the ED one time in the next year. So those are the kind of things that the PHPs will be able to do, that follow-up that's so important, to find out why those patients are having recurring problems. So we're looking forward to seeing what that outcome is going to be when the transformation goes live next July. So it's very exciting. The idea is folks are going to get better care, and they're going to get it in one place where there's not so much confusion, and they'll get it on a regular basis, and there will be follow-up. So it's we're looking forward to seeing how that's going to work, but we have high hopes that it's going to produce really good outcomes and that people are going to get much better care.
Thank you.
I would like to tag on to that. I think with Senator Kravick, just that story really opens, I think, another perspective on the delivery of quality care and meeting the needs of families and students. And that is, there's more to every story. Now, my guess is that sadly, the story of these frequent emergency room visits is not unusual. There are probably way too many of these stories across North Carolina. These are incredibly expensive, when all it actually took was a refrigerator. It's because we looked more deeply into the issue rather than just respond to whatever pops up in front of us. And that, I think, behooves all of us to look more deeply. As I'm fond of saying, there's more to every story. I don't care what the story is, there's more to every story. And sometimes, in practice, possibly even frequently, the answers to our problems are really a lot simpler than we make them out to be. We overcomplicate everything with forms and people, and we're always looking for somebody else to deliver something else. When, if we just talk to each other, I was particularly warmed by the opening comments when it was noticed that we used to sit at a table and talk to each other. What a concept! We talk to each other rather than throw rocks at each other? What a concept! This is really the basis of how we're going to provide quality care for every individual. Now let's let's then leverage that with today's efforts on telehealth. And there are now amazing stories of what's happening in our ability to deliver quality health services to people using telehealth. We know we have a real challenge in our rural communities, a real challenge of getting doctors there and then getting them to stay there. So we have an opportunity. Now, of course, we've got to do better with connectivity. And now we see the circle, and we come all the way around, connectivity, devices, etc. But the good news is we're actually making progress. We're making progress by identifying the fundamental cause of a particular challenge, the fundamental cause, and then being able to deliver a solution that actually works, and not just one time, but actually works. So I couldn't be more pleased with that. The fact that these doctors took it upon themselves. You know what? There's a story. We all need to take it upon ourselves. And that's the wonderful thing about Prevent Child Abuse North Carolina and NC Child and all the other organizations represented by this collaborative, is you guys are stepping up. Not looking necessarily just for the government to be the ones to do it, but we're all stepping up, and that's what we all have to do, is reach a little further, reach a little more deeply, take personal responsibility, ask an extra question. You know, I know you're here, I know what your problem is. I'm kind of wondering why you have the problem. So this is wonderful where we're going. Now, I'd like to speed up the process.
Yes.
But we're on the right track.
Awesome. Thank you so much. All right, Ann?
Well, that's actually a nice segue because with the pandemic, a lot of families have been impacted economically. Some parents have lost their jobs, and that may mean that they've also lost their health insurance. But in the Western Institute, we had a really good discussion where Representative Stevens was really talking through the issue of accessibility of services and really building up the community. And I think this speaks to what you were saying, Representative Horn, about having communities pull together and look at what are the issues. And then Senator Kravick, you were talking about whole person care and how do we look at whole person care? So I know one part of that discussion is, is there an insurance gap and is there a coverage gap? But Representative Stevens, I think, laid out nicely that there are some other issues too that we have to look at about accessibility of different types of community providers and different types of supports. So I don't know if either of you have some thoughts about that.
Well, I certainly do. I'll start by recognizing the challenge of the gap. And there's a lot of reasons for that challenge, money being one of them, but not the only one. Sometimes it's just being informed. Not every family knows what's actually available to them or knows how, even if they know what's available, they don't even know how to access it. So there's an information gap. There's also a motivation gap in some cases, and there's a variety of reasons for that. There are cultural reasons, there are socioeconomic reasons. So there's a lot of work to be done. There's no magic light switch where, well, we'll just throw some money at it and it'll fix. We've got to do lots of things. And one of the things that we really need to do is grow our own, is do this homegrown approach to training, recruiting, and retaining high quality providers in our most poor and most rural areas of our state. Providers that are in some cases multilingual. There's another challenge. So the challenges are myriad. Again, a reason for the existence of this very collaborative to identify those challenges and to develop strategies to address those challenges. But nothing works in isolation. It's not just, we'll just do that and it works. If that was the case, we would have fixed this a long time ago, because we've had a lot of just do that's and only find out it didn't work out so well, because nothing stands alone. So you guys are on the right track. I commend you for what you're doing, but we've got, of course, we've got to make sure what's that part from the beginning? Talk to each other, ask an extra set of questions, take that individual responsibility and initiative, and make sure that our people are informed, because sadly, There's an awful lot of people that are not informed. They just honestly don't know what to do. And so we are like any other state. We are hamstrung by our weakest areas, and we've got to identify those areas and then do something, and not just talk about it, but actually do something about it.
Senator Kravick, do you have any comments on that?
Yes, Representative Horn hit it right on the head. We have a lack of access, particularly in rural areas. There are areas in parts of our state where the nearest provider is 50, 60 miles away from some folks who need care. We have been doing a lot of work on trying to recruit and retain providers to those areas by offering some forgiveness loans for some of their student debt while they're in training in medical school, etc. And I think we're having some good success. We do know one of the things that we've learned is that if a person who is training in the medical field comes from a rural area, they are more likely to go to and remain in a rural area. So for quite some time, we've had a lot of docs coming from the Northeast down to some of the rural parts of our state, and it just doesn't fit the lifestyle that they've been accustomed to, so they don't stay. So we have learned that if we can recruit providers who come from a rural area of the country, they will be better satisfied than those who come from urban areas. So our Campbell University has focused on doing that, providing training providers for these rural areas, but it's a real challenge. It's a real challenge, and we have to continue to look at ways to meet those needs of those communities.
Great, and that gets at that health equity that we're looking for. Stacey?
All right. Before the pandemic hit, only 12% of North Carolina workers had access to paid leave, and 1.6 million workers, 38% of our state's workforce, were unable to earn even a single day of paid sick leave. Parents and caregivers are facing tough choices nowadays between work and supporting their children's education through virtual school. What is the path forward to ensure that every family has access to concrete supports that keep kids safe, like paid family and medical leave?
You want to go first, Craig?
Boy, what is the path forward? I wish I had that. I used to have this magic wand. This is the time I'd pull out my magic wand and wave it. What is the path forward? Well, like I said before, there is no magic pill here. There is no a path forward. We've got to hit a lot of paths. As a former employer in my 40 years in the food business, I had hundreds of folks that worked for our company, and maybe more than hundreds, and dealt with corporations all over the country, trying to deal with the benefit package, and which included family leave, paid leave, etc. There's no such thing as free. I'm always amused when somebody talks about their free health care or they're free this or they're free that. There's no such thing as free. Somebody's paying the bill, either emotionally or physically, with money out of their pocket or somewhere. So what's the balance? Now, I'm sure there are employers out there that really, frankly, don't seem to care a whole lot. And we've got a history of some of those employers in this country and around the world. But I'm going to suggest to you that most employers care a lot about their employees. They care a lot. And they know that in order to retain high quality employees, they've got to be able to deliver them, provide the services and the time necessary for them to take care of their family and take care of themselves. They want to do this. We've got to figure out how to help them do that. They've got to figure out, they need to take a look at how they do business in order to be able to lose that talent for some period of time. Before I was in business, I was in the military, and in my line of work in the military, we had this, everything was based on need to know. Well, because everything was based on need to know, there were a lot of things that you actually needed to know, but you didn't know you needed to know them. And as a consequence, you didn't know them, you didn't have access to the information, and if you weren't there, things stopped. Well, the world has changed since those days, and we know it's got to be much more integrated within companies and outside companies. So we've got to find this way to work together. And that gets back to, again, quoting from the opening speaker, the ability to sit down and actually talk to each other. We've got to share these goals for individual, personal goals, company goals, industry goals. We got to share them, come together and say, okay, how do we best serve first ourselves, our families, my personal needs? How do we serve the needs of our company so we can provide these services? Recognizing that you, whoever you might be, play an integral role in our success as a company. But you also, we need to keep you, so we need to keep you happy, we need to keep you healthy, and that means keeping your family healthy as well. So we need to ensure that we share our goals and we accept the responsibility that we are in this thing together. It's not just a paycheck. We're in this thing together. COVID has shown a particularly bright light on these challenges because we're all in this together. And you know how we're going to get out of it? Together. Let's talk to each other and share those challenges and those needs. And because I believe we can figure it out and be able to provide, for the most part, again, no free lunch, but be able to provide the help a family's going to need so they can help themselves.
Senator Kravitz?
Yes, Representative Horn, you hit the nail. Nothing is free. Somebody has to pay for it. And I agree, as a small business owner myself, and having had different employees through the years, those employees, particularly in a small business, become part of your family. And you want to do everything you can to keep them. You want to do everything you can to help them. But particularly most small businesses just aren't able to do that. Small business owners, I make very little overall. The average pay, I think, for small businesses, the majority of it is under $100,000 a year. Some don't pay themselves anything at times. And I know lots of people who have been doing that during the COVID pandemic, paying their employees and having to take money out of their pocket to do it because their businesses are not doing what they were before. So a lot of our large employers are able to do that, but all of them just aren't. I think that the majority of those companies want to keep as Representative Horn said, want to keep their employees happy, want to keep them there for a long time. You don't want to retrain somebody once you've trained one. But there again, they have to work together and try to work out a solution. And I think those business owners who can, I think they are, the majority of them that I know, make lots of allowances for those employees when they do have needs to meet needs of their family's health crisis or whatever. I know many employers who are absolutely doing that. So we have to continue to do all we can to support those families. But if it's a mandate where businesses have to do that, I think that might be a critical crisis for many of them, because you have, if you're paying somebody while they are out on leave, then you have to replace them with somebody else. So you're basically paying twice, or some of the work is not going to get done. So there's a whole lot of things that we have to think about, we have to consider. But I think most employers will work with their employees to do that, and we should certainly encourage it as much as we possibly can to make sure that they are meeting the needs of their employees and their families during health crisis.
Now, there are things we can do in order to encourage employers to do that. We've got to be taking a look at our tax policies and our regulatory policies. We've got companies, and I ran one of them, that I was always determined that we were a sales organization. So everybody in our organization had to be, whatever they were doing had to be associated with selling something. A friend of mine ran a car repair facility, He had about 60 employees, and everybody had to be working on cars, except the government came along with all these regulations. Now I started having to hire people to fill out paperwork. Well, that cost me money. Well, where's that money coming from? Because I wasn't getting any more cars in, or I wasn't selling anything more, but I had to hire additional people. So the government can do some things, get off people's back, encourage them, provide policies that encourage them to support and allow them to support their employees. Now, there's bad actors in every business and every walk of life. There are bad actors, and I'm not going to let the tail wag the dog, but I'm going to try and weed out those bad actors and reward the good actors so that we get rewards to the families that need the services that and will therefore add to the sum for everyone.
All right, thank you. Anne?
Yeah, thank you for your comments. It got me, thinking that people are working remotely so much now. And I think that businesses are beginning to see how they might be able to structure that to make it work.
That's right.
And to look at productivity and see that it can work. And I recognize that it can't work for all industries, but there are some that I've been working from home since March, and as well as my colleagues, and we do our Zoom meetings, and we get together as well as we can, and we plug along. And I think that it's given us some kind of opening to some possibilities that maybe we wouldn't have been able to think of before.
Sure.
Okay, I'm going to put my peepers on for another question. Home visiting programs, which match parents with trained professionals to provide in-home support during pregnancy and throughout their child's first years, are an effective method to support families, particularly when they're part of a comprehensive and coordinated system of services. Yet less than 1% of families in North Carolina have access to home visiting in their communities. Parenting education programs, which provide education and support outside of the home, also have limited accessibility across the state. There are evidence-based programs in our state, ones that reduce the likelihood of abuse or neglect, improve maternal and child well-being, increase school readiness, and many other positive outcomes. How do you support the expansion of programs like these across the state?
Well, I've been a big supporter of visiting nurses for a long time. I think that the visiting nurse program is outstanding. I've ridden along with some of the visiting nurses, as well as we have some organizations like Bayada that also provides this home visits and home support. We now have an ever increasing number of organizations providing home support for the elderly. I always get a little amused when my wife and I were watching a news broadcast where the governor was encouraging people to look in on the elderly to make sure they were all doing okay during this time of COVID. And I turned to my wife and I said, "No, they're talking about us, don't you?" Said, "Oh, that's terrible." But the point is, I spent, as I mentioned earlier, almost 40 years in the food business. I felt from the very beginning, the future of the food industry was getting food to the people, not people to the food. I'm going to say the same thing about education. The future of education is getting education to the student, not the student to education. It's the same thing in a work environment. We're seeing it today with COVID, getting work to the people rather than people to the work. And now I'm going to suggest the same thing when it comes to healthcare. We get healthcare to the people, not people to the healthcare. Same thing with families and needing access. We bring the access to them. That is the future. The great news about that is it's opened a whole new genre of jobs, careers, science on how do we do this, effectively do this. I don't know, I'm not much of a television watcher, but maybe some of you have seen a new program on TV, and I can't remember the name of it, about a doctor from Syria that ended up in the US and is working in a hospital. But while he's working in the hospital, he's actually on his telephone directing help for people back in Syria that are suffering terribly. Well, that's part of the telehealth. We've got to find more ways of bringing services to the people, not people to the services. It's more effective. And as a consequence, and I'll key back on something that Senator Kravick said earlier, that when those doctors actually looked into that woman who had been to the ED 60 times, they actually went out to her house and said, oh, you know what you really need is a refrigerator? Oh my goodness. That's the advantage of pursuing this concept of home visits, of bringing our services to the people and not the people to the services. So I think we're on track with that. Well, I should say we're in the right direction. We're not on track. We should have solved this problem a decade ago, but we didn't. So I don't spend a whole lot of time looking over my shoulder at what we didn't do. I try to learn from that and figure out, okay, how do we get to the next part quickly, efficiently? And I think that visiting nurses, BIATA, and those kinds of services are the answer. I'm fascinated by what South Carolina has been able to do in this area, and they've done very, very well. So we've got a long way to go, but we're finally starting to move down that road. And thanks to you guys do a lot of that stuff.
Senator Kravick?
Yes, I too have visited with the nurses, and they've tracked through the pregnancy and through the first year of birth. I've gone on some visits with them, and it's a wonderful program. It is a huge benefit to those families. And I actually have met with several of the ladies that were the beneficiaries of those visits and heard their stories. And some of them were amazing. One had gone on to get a degree, I forget what type, but anyway, in the healthcare field. One had finished high school and was going on to community college. So the difference that it made in their life was just amazing. So it was a great program. It was a huge benefit to those families. And I agree with Representative Horn. We're on the right path. We just have to continue down the road and continue to do all we can to help those families.
And I want to add something that Senator Kravick just brought up. We have 58 community colleges in this state, many of whom have a very vibrant health worker training program.
Mm-hmm.
This is a great opportunity to meld those programs with the needs of their local communities. And many of those communities, we love to say that we have a community college within 20 minutes of every resident in North Carolina. Well, that means we've got healthcare assistance within 20 minutes of every person in North Carolina. Now let's bring all these players together and utilize the expertise that you all bring to this party as well, and train these people, open their eyes so they're not just focused in this area, but in a broader area. We can deliver high quality care right to the door of every person in North Carolina. We can do this.
And I think the thing that I like most about what you all are saying is that you're relating it to families and not just an individual, because when you are talking about children and youth, the family is a very important part of that.
Yeah.
So thank you. Stacy?
All right. So considering that left untreated, childhood trauma costs states billions of dollars in healthcare costs, mental health care, court costs, and lost wages, to name a few, would you be willing to invest in programs that have been proven to heal trauma, such as mentoring programs, high quality counseling like EMDR, and trauma-focused cognitive behavioral therapy in affordable and accessible nutritious food?
Simple answer is yes, of course. The payoff is incredible. So of course, we're seeking those programs that are efficiently and effectively run, and we want to support them. Child care are issues that are near and dear to my heart, as you probably know. I go back to when I worked on Kyla's Law. I don't know how many years ago. I keep some photos in my office of Kyla, just to remind myself of the importance of this issue. So yes, I am willing, I am desirous, and when I say I mean I, the legislature, not I, Craig Horn. I'm old news. I'll be out of here in 3 months, but I could not be more committed now and in the future to seeing that we deliver these high quality services to the people most in need.
All right, Senator Kravick?
Yes, I agree. The answer is yes. We know I attended a seminar down in New Orleans last year, and it was about this very thing, ACEs, the trauma that that children experience, and how do we get around that. And there were representatives from the health field, as well as representatives and senators from other states, and they were all sharing ideas that they were implementing in their various states, these evidence-based treatment for that focused on the trauma that children had experienced. And some of them, it was very interesting. They had some really good input. We learned a lot, and absolutely, those are things that we need to be doing to help those children lead productive lives and not have their past and their trauma to dictate what their future is.
Awesome. Thank you both. Thank you both. Anne?
Okay, another question. Childcare is an essential service for children and families, especially now. Yet childcare centers across the state are closing. Workers make on average around $10 an hour, and many of the workers do not have access to health care. How can we change the entire childcare system so the workers who we trust and care with our children are treated like the essential workers and professionals that they are? It's an open-ended question, and whatever way you'd like to answer it would be fine.
Well, absolutely, childcare is an essential worker, no question about that. And we are committed to making sure that families have quality health care, childcare available to them. And during the pandemic, so many of them have shut down permanently. Those who have remained open have been at 43% capacity, I think, statewide. So their income has been down. And so when we were there a few weeks ago, we made a commitment to reward those child care centers for the work that they have done during this pandemic to stay open, so that those essential workers would be able to do the work that they had to do and would have a place for their children to be safe. So I think we allocated $70 million toward child care centers, and we're going to continue to do all we can to help them. And you're exactly right. It's not a high-paying field, and there's not a lot of profit margin in there. So it's a catch-22. You need those workers, but then those centers can only afford to pay so much. So we need to continue to look at ways. And 60% of those, we have a lot of subsidies for childcare for some of those low-income folks, but 60% are paid for, are private pay. And the cost is a big part of the budget of those families who are working and paying for that childcare service. So we need to continue to look at ways to help those families to make sure that they have good quality childcare, and don't have to worry about their children being safe when they leave them there and go to work. So that's a crucial element of our economic well-being, is making sure that we have good child care for our families.
Thank you. Representative Horn?
Well, there, I could say ditto, and I will, ditto, ditto, ditto. Childcare is an essential service, and we're caught in a bit of a catch-22, and that is this. We need to upgrade, uptrain our early child care workers. We need highest quality people engaging with our youngest kids. We, through brain science of recent years, we have learned a lot about how the mind develops, how the brain develops, how kids develop. So we need our child care workers brought up to date on brain science, so they work more interactively. Kids, this is going to cost a lot of money. It's going to cost money to provide the training, and those people are going to want and need and deserve to be paid a lot more money than they're paying. It's terrible how poorly we pay our child care workers. By the same token, as Senator Kravick mentioned, families are struggling to pay their child care bills. I mean, really struggling. and they're having to make really tough decisions about, do they pay this or do they pay that? Do I eat today or do I go to work today and earn money so that I can pay my childcare bill tonight? So what's the answer? They're all answers. More money, more money, more. Yes. Higher quality. Yes. More facilities open. Yes. Some of the answer is get off of people's back so they're putting their money where the action is, and that is student focus, child focus, putting the money there. We've got to do that. We've got to make sure. We've also got to, it's terrible to say, but we've got some really bad actors out there. So we've got to be looking at cybersecurity and background checks and all that to protect our kids and their families. The families are leaving their kids in our care, as child care providers, but they don't really know what's going on. And then we hear these exposés. Now maybe it's 1%, but if that's my kid, that's 100%. So it's tough. And all of us have got to play a role in this, policing these organizations, demanding more, being willing to pay more, and then being willing to up our what we're providing. Again, a magic pill, don't have one, but yeah, we got to do it. And I think the public has finally, and I will say finally, come into the realization that we're not just babysitters. When I say we, the child care, early child, this is not just babysitting. There's actual education going on. I mean, real education, preparing kids for school, and real education in preparing them for life, because that's where their attitudes are first formed, is in those first few years. Their attitude about life, their attitude about adults, their attitude about other kids. So there's a lot going on. This is a heavy lift, but we've got to up the game across the board and and our child care services can't be the lowest of the low. We got to be paying more and getting more.
So to that end, I'm wondering, and just about the whole theme of this institute, what can we do? What can advocacy organizations and what could families do? What kinds of information can we provide you, and resources and support as legislators? How do we help you to kind of work through these issues? Because we've talked about several that we just have to work through them. There's not one way to fix it. So what are some thoughts of yours, or what can you tell all of us in the audience about things that we can do to help you?
Well, you can help us ensure that the training we're giving our child care workers is high quality training, not how to check another box and fill out another form. We need guidance from you all as well. Secondly, we need you all to police yourselves. Every profession has bad actors. I don't care what it is, every one of them. We got to weed them out, which means sometimes we're going to have to say to a friend of ours, you're not doing the job. You're not doing the job. That's hard to do. That's really hard to do. So we need your help in that area. We need your help into what are the training programs that are high quality. I mentioned that, but perhaps you all know of programs that you can support and provide. Where are those programs that can train folks well? And then the other thing is, I'm going to ask everybody on here, give an honest reference. Almost all of us are asked for references. Oh, my neighbor's daughter would like you to write a letter of recommendation. And we tell them how wonderful she is, but we really don't. We also know that kid's a snot. Now, so we need some honest references. There's lots of things we need, but you guys can give us a lot of direction in making sure that we're on the right track.
That's
Come
great.
on, we're elected people. What do we know? So that's how I look at this thing.
Senator Cobb?
I would say providing us with information. I tell this a lot to people. When we're elected to office and we go to Raleigh to serve, you know, we know a little bit about what we did at home, but we're asked to make decisions on things that we have no experience with. And we rely on others to give us the information that we need. So I would say the boots on the ground know what the needs are, and we don't. So by keeping us informed on policies that work, policies that don't work, and we do need honest evaluations. As Representative Horn said, we need honest evaluation, no matter who it is or what it is. We can't make proper decisions if we don't have honest evaluations. So I would say just identifying what the needs are and then sharing them with us and give us your ideas of how we can improve the system.
Wonderful. Well, we are that 10 minutes out, and I wanted to give you each those 5 minutes to talk about what you want to do to wrap up in whatever way you want to. But Senator Kravik, I was wondering if within your 5 minutes, if I could ask if you could touch on the Child Wellbeing Transformation Council, what the next steps are for those recommendations. So do you mind if we start with you?
Thank you. I would be honored to do that. The Child Wellbeing Transformation Council started out with, it was the brainchild of former Senator Behringer and Representative Stevens, and they saw the need for making a lot of changes in the system. So when Senator Behringer left, then I stepped in, co-chair with Representative Stevens, and we did some amazing work on that committee. We had input from everybody that is in the child care field at all. DHHS, we had guardian ad litems, we had foster parents, we heard from everyone around the scope, and we learned so much. It was absolutely amazing. And prior to that, I served on the SWIG group, which was the Social Services Working Group, and the Child Wellbeing Council came out of that to some degree. All of it came about as a result of Ryland's Law, which was to improve the plight of foster children and children in our welfare system. And we hear every day of the problems that face those families and those local communities. And just last week, our health committee, we issued a subpoena for a director, one of our counties, where a 9-year-old girl, the police were directed to leave her in a hotel room with a man that she did not know, where there were 150 needles and drugs in the room. And the police officers just refused to do it. And they took her back to the station with them and found a grandparent that lived in Tennessee, and they kept her there until the grandparent from Tennessee, 6 hours later, came to pick her up. Thank God they didn't follow those directions and leave that child there. So these are the kinds of things that we want answers to. And the Child Wellbeing Transformation Council looked into all of the implementation of the rules, the regulations, the guidelines we have at DSS and through child welfare. And we made a lot of recommendations that I think are going to be a huge in uncovering what the problems are, identifying the problems, and making the changes that are necessary to make sure that our children are safe and that we can feel certain that everybody is trained to know exactly. And we couldn't get answers. We still don't know who gave the direction to leave the child there. We don't even know if it was an authorized person. So there needs to be more accountability, and that's what the Social Services Working Group, the SWIG, we met for about a year at the School of Government, and we came up with some regional plans to have oversight for those counties, because currently, folks tell me all the time, call the state to get information or to make a report about something, and the state will say, we don't have any oversight over your county, you need to go in your county. Well, they've already had a problem, and that's why they're trying to seek advice somewhere else. So we still have a lot of work to do, but those two programs, the SWIG Working Group and the Child Wellbeing Council, have done some tremendous work, and I think we've learned a lot, and we're implementing a lot of the ideas that came out of those work.
Thank you. Representative Horn?
Thank you very much. Thank you to all of the organizations that are represented here today in the collaborative. I'm very appreciative of this opportunity to share my own thoughts and experiences, as well as learn from you all. I want to congratulate Senator Kravic on her work with in child care and the child well-being. We all dearly miss Senator Barringer here, who is just heart and soul into the foster care program. And we know we have real challenges. We are in desperate need of high quality foster care families across this state. And it's really hard, and particularly for kids with disabilities. It's a terrible challenge. When I say terrible, it's terrible because it's so difficult. It's a joyous challenge because the rewards are so tremendous when we can match up the needs of a child and the needs of a family and bring them together. I have firsthand understanding of the foster care issues from my own youth. And I hear the stories that, like Senator Kravic just gave us about that young child. Well, we don't know who's responsible, and nobody's responsible. And as you know, in our state, every county is independent of every other county. And we in Union County had a terrible incident a few years ago where a policeman happened to hear a noise he couldn't identify while looking at an unoccupied property, and went over to find a child chained to the back porch, and discovered that child actually was under the care of a child care worker in our county. We've solved that issue. Thank goodness Union County has been able to work with others. But what we discovered is that child was placed out of another county into Union County. Nobody bothered to tell us. What? Come on, folks. Where's that part about? Here I go back to the very beginning, sitting down and talking to each other. We can solve these problems. These are our kids. Come on. These are our kids, all of our kids. Here in the legislature, we also have the Child Fatality Task Force, which does yeoman work on looking out for what can we do to improve outcomes for kids. And you know, that should be the litmus test on everything we do, everything we talk about. The litmus test should be, do we have a short, straight line between whatever it is we're doing, whatever it is we're talking about, and an outcome for a kid? That's the litmus test, an outcome for a kid. Our teachers are involved. Our teachers care deeply about their students. Parents are involved, and most of our parents care deeply about their children. Well, we all should care deeply about them, because we know it's a little bit almost silly to say they are the future. Of course they're the future. But we can build a better future by building better kids now. And we can do that by delivering high quality services, being super critical. Come on, show me the outcomes, and let's do what works. We know everything doesn't work for everyone. So let's do what works. Let's put our heart and soul into it, and recognize that we're going to have to constantly reevaluate. But you know what? We can do this. This is North Carolina. We can do this, and we will do this. And thanks a lot to you all for helping pave the way to that. Thank you very much.
Thank you all so much. Representative Horn, we wish you the best in your future endeavors. And Senator Kravic, we will see you and look forward to working with you at the legislature. We just really appreciate all your comments and the caring that you have for North Carolina's children, and the support, and just being here today and giving us your thoughts. Thank you. Stacy.
Thank you all so much. Thanks for planning this. It's been such an honor to be, and I appreciate the work that you're doing.
Thank you.
Thank you all very much. Everyone, be safe.
Thank you. Thank you both.
Thank
All
you.
right. Bye. We would like to thank all of our presenters and attendees today. We hope that you found the content useful. We'll appreciate any feedback via the survey. We appreciate all the presenters, speakers, and the co-sponsors. and thank you all for making this happen. Here is the link if you would like to do it now to the evaluation from today's institute, where you will be receiving a follow-up email with this survey link in it to fill out, with a link also to the recording of today's event. Again, we thank everyone for their time, and we look forward to receiving your feedback. Thank you.